Hello. Today I'm joined by several people from school districts up in northeastern Wisconsin, as well as Medical College of Wisconsin, to talk about a bill that I've authored regarding school-based mental health services. So first I want to start off by introducing Mark Derwachter from Kaukauna, Superintendent. Thanks for being here.
You're welcome, Jim.
Judy Baseman from Appleton Public Schools. Thanks, Judy.
Thank you for having me.
And Dr. John Lehrman from Medical College of Wisconsin. Thanks, John.
It's a privilege to be here with you, Representative Steineke.
So really what we want to do is we want to kind of go over what we're looking at in this legislation as well as where we started. And where we started was the Child Psychology Consultation Program back in 2013. That legislation was introduced and went into effect in 2015. So Dr. Lehrman, you've been running this program known as the CPCP for a number of years now. Can you just give us a brief overview of what that looks like and what it does?
Sure. Thank you. So the Child Psychiatry Consultation Program is a program that makes a child psychiatrist and or a child psychologist almost immediately available to pediatricians and family medicine doctors across the regions that we serve. The idea is that we can provide curbside consultation within 15 minutes to the pediatrician to give them guidance on the assessment and or management of mental illnesses that they detect in the children that they're serving. And right now, across our state, there is such an extreme shortage of child psychiatrists. For example, 49 out of our 72 counties don't even have one outpatient child psychiatrist, that it could take 6 months to 2 years for a child to get in and see a child psychiatrist. What this program has done, which you introduced as a bill with Senator Darling in 2014, what it's done is it's made this access available for consultation to pediatricians in time, and it also is built to provide education to primary care providers on mental health care, and it also helps through a resource coordinator that's also involved in the project. They help connect kids from the pediatric clinic to other mental health resources in the region, and so basically we've rolled this out and now are serving 750 primary care providers, including advanced practice providers, across many regions of the state, and we've provided over 3,000 consultations since this started, and have also provided 1,200 education episodes for primary care providers to make them more informed in providing mental health care to the kids they serve. And so we see this as a major step towards improving access to child mental health care, and with your support, we've been gradually building it out across the state.
Well, and as you mentioned, it's been in place for about 4 years now, right? And so can you talk just briefly about what kind of response you've gotten from pediatricians, how successful it's been?
So we've had tremendous success and response from pediatricians and family medicine doctors who have utilized it. We have over a 90% of satisfaction rate with as we survey the physicians and advanced practice providers who use the program. Over 94% are satisfied with what the services they get and the education they get from the program. I think even more meaningful, what we're seeing is that some of the clinics that are utilizing this program previously were afraid to screen their children that they serve for depression, and now because they feel backed up with this program, they're routinely screening the kids that they serve for depression, and they feel more comfortable in treating the depression, being backed up with this expertise that they have in this program.
Well, that's fantastic. And, given the success that we've heard about over the course of the first 4 years of this program, I know we started thinking about ways that we could expand it, reach even more kids, help even more people. And one of the things I hear a lot, having a wife that's a teacher, happens to be in Appleton Public Schools, educators themselves often feel not as well equipped as they'd like to be in dealing with some of these issues that arise in the classroom, and how best to help the kids and how best to recognize the symptoms of mental illness. So when we started thinking about that, and we approached Medical College of Wisconsin about possibly doing a pilot program in the schools, the one thing I'll say is you guys were chomping at the bit to help out wherever you could, and I appreciate that so much, because the need is so great, and I truly think that if we can reach those kids at an early age, the earlier the better. And I know I think all of you guys would agree on that. The earlier we can reach them with these services, the better. So, Judy, from your perspective, how do you see this operating? You know, is there a gap in access, or a gap in education resources for staff within the schools, where you think this will help?
Absolutely, I do. We do have many things in place in the Appleton Area School District, preventative type universal supports. We've worked hard with our trauma-sensitive schools training and so on. But when we get to the cases that would require more expertise, there's a lack in terms of child psychiatrists in our community, in our area. Our school psychologists, our school counselors work very hard to problem solve on a day-to-day basis, but very often they're faced with a very complex case, and they just don't have the expertise to really find out what is it that's causing the behaviors or the challenges, and it would be so helpful for them to have that opportunity to call and consult on those cases.
Great.
So.
And I know, Mark, that your school district has dealt with issues in the past that you've been working really hard to overcome, and have done a phenomenal job at increasing resources for kids in your school. How do you see it working in Kaukauna Public Schools?
Yeah, thank you, Jim. There's been a tremendous amount of work about our past inspiring our future. That's really where we're at with this, is that we see several elements being very helpful for us. One, that educational piece, that professional development piece. Judy knows this, is that we are constantly training all of our staff about the needs, the unique needs that our kids are coming to school with now, and I think we do a really good job of that. And I also think that we're ready for a next step in terms of that training, and that's where medical college and their expertise can really help us take that next step, because schools want to take that next step. We want to find everything that we can to help our kids in those moments of crisis, or as we talk about this mental health continuum of green, yellow, orange, and red. So when our kids are in that orange and red zone, we really want to do the right thing. And oftentimes, now you talk about that gap, oftentimes that our staff does have expertise to work through those orange zone areas. But once you get into that illness and you were talking about crisis moments, we need that expertise support, and this is where CPCP can come into play. I can pretty much assure you, though, is that our school counselors, pupil services staff, they do not have access to speak to a child psychiatrist or a child psychologist within 15 or 30 minutes of a case presenting themselves. And that's where this becomes so unique, where we would have literally that immediate access to vet the work that has been going on, to check and make sure we've dotted the I's and crossed the T's. And now we're at this point that Judy is talking about, is that, you know what, we need some additional support. And that 15-minute conversation likely could be the deal maker for us, and that kid and for that family. So we're very excited about this opportunity and know that it will help our kids.
Great. And I know one of the points of conversation around this legislation has been, why Outagamie County? And I think from my perspective, when we were talking to the Medical College of Wisconsin, really what we were looking for is an area that already had some resources, that we weren't starting off from scratch, because you don't want to be overwhelmed in a pilot program, but also had some diversity, some economic diversity, especially some school districts that had some resources that were really helpful to what they were doing now, and then other districts that didn't have as many resources. Can you talk about the diversity in your school districts as far as where the kids are coming from, what you're seeing as far as the economics and the struggles that some of the kids have versus some of the affluent areas.
Well, our district is definitely a mix depending on which area of the city you reside in. So several of our central city schools have free and reduced lunch percentages or poverty percentages of over 70%, and then other areas of the city, not so much. But we embrace all, and we work with students from all backgrounds, ethnicities, and we find that when we do have this continuum of supports, we are able to use that kind of tiered approach where we have a universal supports that we provide for our students, educational in social emotional learning, but then we layer on those supports as needed. But socioeconomic status, it really doesn't play a role in where we see mental health challenges. It's across the board. So we need to be prepared at all of our school sites and communities and across our district to meet the needs of our students and our families.
I would agree with that. I mean, our school district is in the 20 to 25% socioeconomic disadvantaged. We have schools that range from 20 to 50%, but mental health is not discriminating based on economics. We all know that. So the other thing that I think about in terms of Outagamie County is that this is the business model. So if this is an alpha program and we're trying to develop this as a pilot, I think it's just really important to try and reduce some of the risk that are going to prevent success. And Outagamie County, like many counties, is doing a really, really good job with that. So I think that there is an infrastructure and in Outagamie County that can really reduce some of the pilot risk there, and we can find success so that ultimately then we can use this as a model, which is the goal for us to grow this. I will say though, in terms of not necessarily economic or ethnicity, but just the behavioral differentiation that we are seeing. Our kids are coming to us with more and more behavioral needs that are generally linked to wellness issues. And I think that, honestly, I think that they've always been there. I just think that because we are so much better at identifying what are the needs of kids, is that we just really know is that this kid is behaving this way, presenting this way, is that it may be in this family of mental wellness. We're just better at that. And with being better at that means is that we have a responsibility now to address that. So the more information you know, the more you got to work with it.
Right. Well, and I think as a legislator, one of the challenges always in getting bills across the finish line, right? Getting them through the Assembly, getting them through the Senate, and to the governor is for his signature is about telling the reasons why something is necessary. And I appreciate. I think you've covered that pretty well. As legislators, though, if you had one thing that you could tell legislators on why they should support this, especially given its limited size to begin with, what would that be for a legislator that represents an area outside of Northeast Wisconsin, maybe from Southwest Wisconsin or Northwest Wisconsin? Why is it important for them to support a program like this in Outagamie County?
Perhaps I can start on this one. So one statistic that I think is really critical for everybody to hear is that 50% of mental illnesses start to present themselves by the age of 14. So half of mental illnesses start to present themselves by the age of 14, and almost half of us in our lifetime will have some kind of mental illness. So that says a lot when you factor in the lack of access to mental health resources that we have. And so I think what we're proposing here, what you innovatively thought about, Representative Steineke, being married to a teacher and understanding this, and talking to us with this bill that we've about this bill and with what you had helped us build before with the Child Psychiatry Consultation Program, would be to leverage some of these resources in a way that helps the schools and helps the kids where they spend so much of their time during that childhood, where they have people that really care about them, are trying to help them grow and develop, that can really detect some of these problems that start to present themselves. This is kind of like the perfect way to make this resource that you helped us develop be available, and maybe to help in develop some extending our expertise and add some access to this expertise in the schools, where I think it can even make a greater difference. So I think that's what I'd like to tell the legislators.
Judy?
Well, our educators will never give up on any individual child. I mean, they give it their all. They bring concerns to the student services group, school psychologists, counselors, nurses, but there comes a point in time when everybody is given whatever they can in terms of creative thinking and problem solving, and they just need another resource. And this would be a beautiful way to let our educators know that we understand the challenges that you're facing, and we have this resource that we want to offer you to support you day to day, because it's there and they feel it every day, that desire to help, and they just run out of ideas.
Perfect.
For me, I'd like the legislators and the governor to know is that this is, in my view, this is an absolute win-win. And we often do not find ourselves in positions with win-wins. Issues that come into our offices, and they are very, very complicated. This is a complicated issue also. However, I feel very confident that this is a win-win, and legislators and the governor hopefully see it that way as well.
Great. Well, and to close, I just, first of all, I want to circle back and thank all of you for being willing to participate in this piece of legislation that will hopefully become a pilot program and an example for the rest of the state. The thing I love about working with not only Medical College of Wisconsin, but school districts in the Fox Valley is that everybody's oars are in the water at the same time, moving in the same direction. People are more than willing to find a way to get to yes instead of finding ways to pick things apart. And I think that's the kind of partnership that will eventually make this a success, not only in the Fox Valley, but then allow us to replicate this in other areas throughout the state. So again, Mark, thank you for your leadership, and
You're
Judy,
welcome.
thank you for yours, and John, I really appreciate your work on the original CPCP and for your willingness to continue to make a difference for the kids of the state of Wisconsin. So thank you.
Thank you for your partnership and your innovation.
Thank you.
Yeah, great vision, Jim. Thank
All
you.
right. Thanks,
John.
everybody.
Great, yeah.